Hi, you are welcome. In my previous video, we discussed high blood pressure, its causes, diagnosis, risk factors, the dangers associated with prolonged high blood, and its medical management. Today, we will discuss the natural ways to lower high blood pressure. These lifestyle changes serve as the first line of defense when it comes to lowering blood pressure. They include 1. Lose a little weight. Researchers discovered that extra pounds can cause heart muscle injury. It has been known for long that when you are overweight, you are more likely to develop high blood pressure or diabetes, which can lead to heart failure. 2. Balance the nutrients in the foods you eat. Eat a diet high in whole grains, fruits, vegetables, lean protein, and low sodium. That means you should reduce your salt intake. Salt intake is high around the world. This is largely due to the increased consumption of processed food. Many studies have linked high salt intake with high blood pressure. Swap processed foods for fresh foods. Also, try seasoning with herbs and spices rather than salt. 3. Get or stay fit. Being active helps to keep your weight in check and makes you less vulnerable to heart diseases. Engage in non-strenuous exercises. 4. Monitor your blood pressure on a daily basis and report to your doctor when it exceeds 120 mm of mercury for systolic and 80 mm of mercury for diastolic. 5. Do not smoke. 6. Proper stress management. Yoga, meditation, and music can be helpful depending on individual preference. Space out your daily activities. 7. Limit alcohol. Drinking too much can raise blood pressure and can also make blood pressure medicine less effective. 8. Get a good night's sleep. Sleeping less than 7 hours every night for a few days makes one vulnerable to being hypertensive. As an adult, you should get at least 7 hours of sleep every day. 9. Control your cholesterol and blood sugar. High blood sugar and high levels of cholesterol raise the risk of heart disease. Avoid or reduce the intake of foods high in cholesterol. 10. Eat more potassium-rich foods. Potassium is an important mineral that will help your body get rid of sodium and ease pressure on your blood vessels. They include fruits, vegetables, bananas, avocados, oranges, nuts and seeds, beans, and dairy products such as milk and yogurt. 11. Cut back on caffeine. Caffeine intake instantly increases blood pressure. Although it causes a short-term increase in blood pressure, it is advisable to avoid it entirely if you are hypertensive. Reducing your coffee intake helps as well. 12. Cocoa intake. A 2017 review of studies found that flavanol-rich cocoa products may temporarily reduce blood pressure in healthy adults. This is according to the National Institute of Health. 13. Eat berries. Berries are packed with polyphenols, natural plant compounds that are good for your heart. Polyphenols can reduce the risk of stroke and heart conditions and improve blood pressure. In one study assisted by the Northern Ireland Clinical Research Network, the study suggests that a well-tolerated polyphenol-rich diet could have a positive effect on microvascular function. 14. Eat foods rich in magnesium. Magnesium is an important mineral that relaxes blood vessels. According to studies conducted by the National Institute of Health, getting too little magnesium is linked with high blood pressure. 15. Eat garlic or take garlic supplements. Garlic lowers blood pressure in hypertensive individuals, regulates serum cholesterol, and stimulates immunity. Please take care of your health today.